Well, AI is just new technology. It's no different than many years ago when we introduced the word processor when people were typing. People had to change the way they did business, right? People had to learn a new way of typing on a computer. We're gone were the days where you'd have to type multiple pages and use blue steno copies to make copies. So it's just a technology change. So what's going to happen to our workforce is we're going to help our workforce scale. The reason that we're introducing AI and other technologies is because we've reached our scaling limit. It's very hard for us to bring on a new customer. So think of the future when we want to expand IKS from where it is today and double, triple, quadruple in size. We can't keep adding more and more and more and more people. They don't exist with the expertise that all of you have. So if we can help you scale with technology, that's our objective, and that's why we're bringing AI. I think the two go hand in hand. Everything we do on the AI side is contributing to delivering clinical value for our customers. We can do even more because if you think about it, if we can actually leverage AI and analyze a patient's record before the clinician even sits down to meet that patient, we can deliver new information that doesn't currently exist for that clinician. So think of it as a clinical summary prior to seeing the patient. I know today when I go to see my primary care physician in the United States, he's so busy that he might remember who I am because I've seen him probably a dozen times, but he doesn't really remember my medical background or why I'm all the history related to the care that he's providing me on that day, because he hasn't had time to read it. So picture leveraging AI to give him a clinical summary, maybe one paragraph of the most important things that you can read. We can do that easily. We can do that because we have access to the data. We can actually examine it. We have access to the large language model, so we can put it into clinical workflow. So what AI is going to do is, it takes time, we have to get the data, but we are going to deliver real clinical value to our customers.